Uh, I just want to do a little bit of wrap up and share a little bit around some of the work that CVC is doing to try and respond to some of the challenges that other members of the panel have actually indicated. So I think we would agree that the challenges are consistent across all of the different groups, whether we're talking about gay men, trans people, or we're talking about lesbian women or bisexual women. There are some common threads that run through the conversation that we have heard so far. The other thing that we have noticed is that as we talk about the health needs of lesbian, gay, bisexual, trans, and intersex people, we recognize that the health needs are connected to other aspects of society. So we talk about the socio-economic issues that impact people's health needs, and we talk about the legal and policy barriers that would have an impact on people's access to healthcare. And those, I think, are some of the overarching concerns that we have identified from our work and that CVC, along with our colleagues and partners, are working to respond to. So let's start a little bit at the structural level, which is the policy level, and we share a little bit about some of the work that we are doing at CVC and among our partners. And so we work at the structural level to try and address some of the principal barriers to access to healthcare services that have been identified by my colleagues. And we do that through several things. One is that we do community monitoring of health facilities and healthcare service provision to be able to use that information to inform recommendations for improvement at the operational level. And so what we do is that we would do community scorecards, we do other community level monitoring activities, and we would share that information with the service provision site to guide them into how they can better develop interventions and healthcare services that can meet the needs of the various communities that we are interested in. The second thing that we would do, we would use some of that information to develop position papers and policy briefs that would then be shared for use to develop national level service interventions or service policy. So I'll take an example. We are pushing for national inclusion of things like PrEP. We're pushing for things like, and we're talking here about HIV-related services. We're talking about the inclusion of trans-friendly services at the national level. So not just at the level of a health facility, but that this should become a part of a national policy or a national strategy for ensuring that wherever a member of the LGBT community goes to a site, a health facility, they can actually get the requisite service that they need in the form that they need. And we also are working with the national health facilities and health providers to develop differentiated service models that can be rolled out at country level. We also, once we get that data, we use some of that data to inform redress. So where people feel that they have gone to a health facility and there are issues with access, we work to facilitate improve access for our redress for these individuals. So a lot of our work is around advocacy, around policy. And then we also do prevention work where we initiate prevention interventions that are directly targeted at the communities and the populations that we are interested in, the LGBTI population, to ensure that they have community level access to healthcare services as well. And that would include things like building health literacy to help them understand better around what some of those health needs are and how they can actually claim some of those health needs. We would also provide empowerment support for the communities through empowerment interventions, as well as we would provide facilitate access to different service points across the different countries in the region. In order to address some of the socioeconomic needs, we are currently rolling out social enterprise activities, as well as other community empowerment activities that would assist members of the LGBT community to be able to meet some of their economic needs and some of their life skills needs that they have. One of the big issues that was raised coming out of the presentations was the high incidence or prevalence of HIV among the population. And that is one of the areas that we are actually paying very close attention to and seeking to address through trying to push for the scale up of PrEP and HIV self-testing among the various populations, as well as doing work with healthcare providers and community level providers to address the HIV and sexual reproductive health needs of the communities. The other area that we are working with our partners on is around addressing the mental health needs of the communities, because we believe that that's a significant issue that needs addressing. And so we are working with our partners to ensure that those interventions are put in place to address the mental health and psychosocial needs of the LGBT community across the region. At the level of policy, there are a number of issues relating to stigma and discrimination that we have identified that create significant barriers to service access. And one of the things that we're doing is working across the region with our national partners to develop anti-discrimination legislation and anti-discrimination policy at the country level and at the regional level to ensure that the needs of the LGBTI community are placed squarely in those various anti-discrimination legislation. So that would include things like ensuring that specific language is included in the anti-discrimination legislation that speaks to sexual orientation and gender identity, as well as addressing issues around hate crimes and incidents where service duty bearers neglect to treat with the health needs of members of the LGBT community. So those are some very specific areas that we are working on. A lot of our work involves providing direct support to people to access service. So I think John and as well as I think Mariella spoke to the issue around people not being able to go to service points because they don't have resources to be able to go. So some of our work involved providing direct support to community members to be able to go to travel to, and to access some of those services where they are. And we do quite a bit of sensitization work with the various duty bearers and the service providers. Part of what we're also doing is building a community of practice among LGBTI groups to identify what works well, what services are best suited to particular contexts, especially when we talk about service delivery in rural communities. And so it would make sense for us to be able to develop these community of practices where we can actually use members of the LGBT community to assist healthcare workers to provide a range of services to the communities as well. And so we do quite a lot of partnership building and build out social mobilization activities that can support the needs of the LGBT community at the ground level. And so at the broad level, I think those are some of